Hi, my name is Kirsten Eagles. My student number is T00698082. And today in this video, I'm just going to be demonstrating how to position and how to help patients who are in recumbent positions. So first off, I wanted to kind of explain more on how we should have our patient's head elevated. So for patients who don't have a traumatic brain injury, we want to have the head elevated, but with the head tilted downwards, so that in the case of vomit or regurgitation, it would just flow outwards rather than flow back down into the esophagus and aspirate. But if we had a patient who had a traumatic brain injury, we want to make sure that the head is elevated at least 15 to 30 degrees above the rest of the body. This is just going to ensure that we have proper venous drainage from the head and decrease our intracranial pressure. We don't want any more than 30 degrees, and we want to make sure that we're not pressing on the neck either, because that can prevent venous drainage, so it'll block the vessels and in turn increase the intracranial pressure. And then lastly, with patients, we don't want them sitting in positions too long. Specifically with the thoracic region, because it can cause mainly atelectasis, and possible fluid buildup within the thorax, within the chest. So we want to make sure that we're moving them every 4 to 6 hours to prevent that from happening. With the hips, we want to make sure that we're turning them every 4 to 6 hours as well, because we can get pressure sores with the dependent side, the side that's laying down. As well, we want to make sure that we're keeping those joints moving, keeping that synovial fluid moving, because that can in turn, if we're not moving them, can cause the joints to sort of seize up and become very, very painful. So please enjoy this video. Thank you. All right, so I'm going to show the passive range of motion technique for patients who we have in recumbent positions. So Rue's going to be helping me out here. So we'll start with the back leg. She's already kind of showing us how. So we start with the toes. So we want to flex the toes. So you're going to hold each one for about 10 to 20 seconds. And then we would extend the toes. And then we'll flex the joint here. We want to make sure we're never forcing anything. And then we'll extend. And again, holding 10 to 20 seconds. And then we're going to move up to the stifle. So we're going to, and yeah. So we're going to flex, and then we're going to extend. And then with the hip, we're going to flex that. And then we would extend, right? Yeah. And then we're gonna do the same with the upper limb. So starting with the toes. So we would flex the toes and then extend the toes. And then we would flex the carpus and extend the carpus. And then we would flex the elbow and extend the elbow. And then we would flex the shoulder and then extend the shoulder. There. All right, so I just wanted to show how to elevate a patient's head or pad their neck in the case of a patient who had like regurgitation or vomiting or was sedated, just to avoid them from aspirating. So you would pad kind of underneath the neck here. So we would take a towel or a blanket and pad underneath the neck, and then they would lay down. When they lay down, then their heads would be pointed downwards, so that if they were to regurgitate or anything, it would come out rather than aspirate into the lungs. So you want to make sure you have nice padding under the neck there and have the head and nose pointed downwards, but making sure also that it's clear here so that they're not going to smother themselves in blankets or anything. Okay, so once our patient is in sternal, Then we want to make sure that we have some good padding in between the hocks back here. So if we had our legs straight out like this, we want to make sure that we have padding in between so that those bones aren't rubbing together. And we want the hips slightly elevated. We don't want them to be squished together. And then with other roll towels and blankets, we would tuck them in onto either side of the patient. So we would have a long rolled towel along this way so that they can't roll over onto that side. And then we would have one tucked on this side as well, just to keep them in that position. And then under the elbows, we would want to make sure that we have lots of padding under there because it is a very bony part of the body. So we would make sure that we would have padding underneath the elbows, just like that. And then with the head, if they're sitting up, perfect. If they're laying down, we want to make sure that we're not having anything that's in front of their face that they can smother themselves. And then we want to keep the head just slightly elevated as well, with the nose just tipped downwards to make sure that we have the airway nice and stretched open.